Can we have everyone's attention, please? I'd like to just make a couple announcements before we get started. We are going to be opening up the gallery for those of you who would like to sit down and are sitting in the back. The way you do is you exit the exit either in the back or here on the side, go up one flight of stairs, and you can enter on the next floor up. And there's plenty of seating up in the gallery section, so if you would wish to sit down. We're going to go ahead and get started with the Senate Health Committee. Today is the 4th. It's about 20 minutes till 2 o'clock in the afternoon. Unfortunately, we do not have a quorum at this time. We will start as a subcommittee. I'd like to make a couple of announcements. Please note that file item number 11, SB 764 Steinberg, will not be heard today. It's now a 2-year bill. We have 2 items in consent calendar. That's item 14 and 15. That's SB 945 and SB 946. Both of these are committee bills. Once we establish a quorum, we'll go ahead and vote on those consent calendars. We will be hearing file item number 12, which I'm sure most of you are here for. That's SB 812 by Senator Leno, single payer. Please, 810. I understand everyone's, why they're here, but I would appreciate that we would not have the crowd speak out or make any comments. It would be very much appreciated. SB 810 by Senator Leno will be heard out of file order, so that this way, when he does show up, he's unfortunately presenting in another committee. The other members have agreed to allow him to go out of file order so that you do not have to be here all day. So thank you. So what we'll do is we have Senator Padilla, item number 1. We'll go ahead and start off with it. Unfortunately, Mr. Senator Padilla, we don't have a quorum, but it's a pleasure to have you here in the Senate Health Committee, and welcome, and please present.
Thank you very much, Mr. Chair, members of the committee. I'll try to make this easy for you. As you all recall, and particularly with your help, Mr. Chair, when you were still in the Assembly, California became the first state in the nation to require nutritional information be printed directly on menus and menu boards at large chain restaurants when we passed that bill and the governor signed it into law in 2008. It's part of our state's comprehensive strategy to tackle the obesity epidemic in the state. And just as the momentum of local city and county ordinances to this effect help generate the momentum necessary for a state law, our state law, along with that of others, helped generate the momentum for a federal mandate. And indeed, the Patient Protection and Affordable Care Act, otherwise known as health care reform, when adopted by Congress and signed by President Obama, it included a provision that required menu labeling on a national basis. To implement that provision, the direction was given to the FDA to adopt and enforce regulations. They've only recently released draft regulations for public comment, so it's still in process at the federal level. The bill before you, the vehicle before you, would seek to conform California's law with federal law. For starters, we have the provision that it would apply to chain restaurants with 20 or more locations in the country versus 20 or more locations in the state, therefore encompassing more establishments than the current state law. And as FDA finalizes other specifics of national menu labeling implementation, then we could very well amend additional provisions to this vehicle. But for now, that's the one piece we want to begin the conformity process with, and I would ask for your aye vote.
Thank you, Senator. Is there any questions from any of the members at this time? No, we don't have any questions. Senator Padilla, unfortunately, we do not have a quorum.
If there are, I'll be downstairs.
Okay, thank you very much.
Thank you very much. Well, there are supporters here to answer questions, or if you want to hear from them.
Okay. Please state your name and your position.
Daniel Conway. Daniel Conway on behalf of the California Restaurant Association. In support, just want to finish what we started with, SB 1420. Thank you.
Okay. Anyone else in support? Is there any opposition?
Nicole Headley on behalf of the Consumer Federation of California in support.
Thank you. Anyone else in support? Any opposition? No questions?
Thank you.
Okay, thank you. Okay, we're going to now move on to item number 3, SB 136, Yi Medi-Cal Telemedicine. Senator, welcome and good afternoon.
Thank you very much, Mr. Chair and Senators. This bill really tries to continue to move the direction of the state of California in the area of making medicine available to all individuals. Telemedicine is part of that. In 2005, AB 354 expanded the definition of telemedicine to include ophthalmology and dermatology. What this bill will simply do then is to extend that sunset date from 2013 to 2015. With that, urge an aye vote.
Thank you. Is there anyone that'd like to speak in support of the measure?
Randy Hicks, Californians for Disability Rights. We're in strong support of this bill because we believe that everybody should have equal access to all medicines, and especially for the disability community, this will make it easier for them to have that equal access. And it's very ADA friendly, so we're in strong support.
Thank you very much. Anyone else like to speak in support of the measure? Is there anyone in opposition? Is there any questions from any of the members? Unfortunately, we don't have a quorum at this time, Senator. When we do, we'll go ahead and bring your bill up.
Thank you very much, and thank you for your consideration.
Thank you. Okay, we're going to go out of order slightly. We don't have any members waiting, so we're going to go to item number 7, SB 594, Woke, Local Public Hospital Laboratories. Senator Woke, good afternoon.
Good afternoon, Mr. Chair. Thank you very much for taking my bill. I want to thank your committee and their staff for their work on this bill. We are accepting all the amendments reflected in the analysis, and we propose authors' amendments to address some of the concerns of those in opposition, which have already been provided to the committee. Before I begin, we commit and look forward to working with all of the stakeholders to come up with a bill that has universal support. We remove the sections which define a local public health lab as one operated by a city or county. We remove the sections which describe the public health lab's responsibility to the health department's communicable disease and environmental health programs. Although we remove the sections, we intend to continue working with the opposition on this entire bill to resolve the issues that the chair and others have pointed out. The goal of 594 is to preserve the quality and ability of the local public health lab system to support local health departments' response to community threats. Since the 9/11 Commission's report, the greatest threat to national security continues to be biological threats. Together, the public health departments and their labs respond to bioterrorism, foodborne and waterborne outbreaks, and community disease transmission. We are trying to strengthen the system in some ways. First, we're trying to establish continuing education requirements for the public health microbiologists, ensuring that the workforce is updated about advances in scientific knowledge. This is a known quality assurance measure. And secondly, it clarifies the working relationship between the health officer and the public health lab director. For everyday disease surveillance as well as times of emergency response, it's really crucial that these two individuals share technical information and decide how to best utilize the limited lab resources. I have with me Dennis Ferrero from the California Association of Public Health Lab Directors to testify in support. Again, I look forward to continuing to work on this with the committee and with our staff and with the all the parties. Thank you. I ask for your aye vote.
Thank you, Senator. Please proceed.
Yes, hi, I'm Dennis Ferrero. I'm the Executive Director of CAPHLD and also a former public health official at the local level, 35 years in 3 county jurisdictions. Ended up my career as a Deputy Director for Disease Control and Prevention in San Joaquin County. I want to thank first Senator Walk for realizing the importance of public health laboratories in California and the importance of preserving those entities. The concern right now for the retaliation to the killing of bin Laden really actually highlights the need for public health laboratories. The first people that you heard from initially after that about concerns for retaliation was from the police area. Secondly, I think you're not aware of, but the public health laboratory system is on heightened awareness and alert status regarding this because these are the laboratories that protect your communities. This event alone characterizes the importance, but more than that, public health laboratories provide support for floods, earthquakes, other kinds of diseases such as outbreaks such as foodborne outbreaks and water and milk multi-county jurisdiction outbreaks. We thank the Senate Health Committee staff for the detailed analysis, and I'm here to answer any questions you might have.
Thank you. Anyone else like to speak in support of the measure? Is there anyone else like to speak in support of the measure? Is there any opposition?
Afternoon, Mr. Chair, Senator Walk. John Friedman, I'm Chief Deputy Director of Los Angeles County Public Health Department. Very much appreciate the recent amendments that were put across on the bill or to be put across on the bill. They resolve a number of the concerns, but I wanted to explain the rationale for the County of Los Angeles' opposition to this is that we don't see a need to alter the legal framework which has been successfully governing local public health laboratories in California for decades. The issues for public health laboratories are not the legal arrangements of how they're operated and where they are governed at the local level. It has to do with technology, workforce, capital issues, and in fact, Los Angeles County has a very strong interest in its public health laboratory and has recapitalized it at $14 million. We have one of the strongest public health labs in the nation. So don't construe our opposition to this to be we are against public health laboratories. We are very much in favor of strong local public health laboratories, but we do not think the legal framework needs to be altered for that. We're particularly concerned relative to a provision that exists in regulation that provides the option for local health officers to use private laboratories for public health work when they may need to do that. We do not have that process in Los Angeles County, but we do not believe we should be foreclosed that opportunity and that flexibility in the future. So we're very much appreciative of the author's willingness to work on this to try to resolve those issues. We have some concern relative to technically using statutes referring to regulations and so forth. And we are concerned about maintaining the existing regulatory authority, Section 1084 of Title 17, that provides the option for the local health officer to use private laboratories when that may be necessary.
Thank you. Next.
Mr. Chair, Senator Wolk, thank you for hearing my testimony. My name is Jim Seuss. I'm the Assistant Director of Policy and Planning for the San Francisco Department of Public Health. And like Los Angeles, we are one of the 38 public health laboratories, or we operate one of the 38 public health laboratories in California. We have taken an oppose unless amended position, and we certainly thank Senator Wolk for her willingness to work with us on these issues. We do, however, have some remaining concerns about the language as we currently understand it. And that is which the first point is that the new language, which we actually did receive late yesterday afternoon, from my layman's perspective, and I've asked County Council for opinion on this, but it remains unclear whether or not we will be able to privately contract any lab services through with these amendments and with this bill. And I should say, like Los Angeles, we have not contracted any lab services out. We are also eminently proud of our public health laboratory. It does great work for the citizens of San Francisco and the citizens of California. But we do need to have the option in these tight budget times of having flexibility locally. Secondly, work is concerned, too, that it dictates a reporting structure for our local public health lab director. We do not see a need for that kind of language to be in statute. Thirdly, it does place in statute regulation, some of which is more than 30 years old, and we have concerns about the relevance of that language. And then finally, we're just concerned about the new costs that could result to us as a county of the new continuing education requirements. That language was stricken from the amendments we received last night. I will just conclude by saying that we locally have been required to make a $69.6 million cut to our public health budget out of local general fund. We have not made any cuts to public health laboratories, nor do we anticipate doing so, nor do we anticipate contracting out at this point. But it is something, as bad budget times continue, that we would like to have the opportunity to consider. Thank you very much.
Thank you. Anyone else in opposition? Please.
Judith Regal with the County Health Executives Association. Regrettably, we still are in an oppose unless amended position, but look forward to working with the author.
Thank you very much.
Cindy Hillary, Regional Council of Rural Counties. We also are still in opposition with the current language.
Thank you.
Mr. Chair and members, Casey Kaneko of Souter & Associates on behalf of the Board of Supervisors of Ventura County. We're most appreciative of the recent amendments that the author has taken and look forward to continuing to see the bill develop. Thank you.
Thank you.
Kelly Brooks on behalf of the California State Association of Counties and the Urban Counties Caucus. We have an oppose unless amended position, and we will continue to work with the author and staff to address our concerns.
Thank you.
Tressa Wallace on behalf of the counties of Kern, Merced, Nevada, Placer, San Joaquin, and San Luis Obispo in oppose. Thank you.
Thank you.
Michael Radigan on behalf of the Board of Supervisors, Santa Clara County. Associate ourselves with the previous remarks.
Thank you.
Melinda McLean on behalf of Orange and San Bernardino, also still in oppose.
Michael Corbett on behalf of the County of Riverside, still in an oppose unless amended position.
Thank you.
Catherine Reese, representing the California Association for Medical Laboratory Technology. If I could beg your indulgence to take a couple seconds, Mr. Chair, because the reasons for our opposition are distinct from virtually all the rest of the testifiers. We represent the clinical laboratory scientists in all the laboratories around the state, outside of the public health laboratories, and probably some within. Our concerns really center around putting in statute, in essence, a 30-year-old regulation for education. You've heard some of the testifiers say they'd like the flexibility to be able to send out their human samples, I presume, and others to outside labs. Where that occurs for the human samples and the human specimens, those laboratorians would have a baccalaureate degree, 1 year's training program, and have to sit for boards. The requirement in this bill for the ability of the laboratorians to do human specimens, in addition to all of the other kinds of things they do, is 6 months. So we would respectfully suggest that it might not be appropriate to have two standards for laboratory specimen testing in this state, one for the rest of California and a lesser one for public health laboratories. So for those reasons, we continue to oppose the bill. We feel there should be an equivalency for whomever is testing human specimens.
Thank you. Anyone else in opposition? Is there any comments or questions from any of the members? Senator Wolk, I'd like to just thank you for working with my staff to work on a lot of the amendments. I know it hasn't removed all of the opposition, and I'm also very glad to hear you say that you're going to continue to work with the opposition as we move the bill along. I will be supporting it. I obviously believe, that the public health labs play an integral role, especially in light of what potentially could happen, some, disasters. So we have to make sure that that safety net is ultimately paramount and taken care of. So I will be recommending, a support, but unfortunately we still do not have a quorum at this time. So when we do, we'll go ahead and bring the bill back up. Senator Wolk.
Thank you very much, Mr. Chair. I look forward to continuing to work with the opposition and those that have concerns. It's my intent to support the public health labs, not to make it more difficult for them. Thank you.
Great. I appreciate it. Thank you. Okay, we are going to go out of order now with item number 12, SB 810, Leno single-payer health care coverage. Let me just, again, reiterate and restate that I'd appreciate if there be no public outbursts, no comments. If you don't mind, Senator Leno, this is, I'm sure you have quite a few people that are going to be testifying in support of the bill. I'd like to ask that we limit the testimony on both sides to 12 minutes. I also understand that there's some individuals that are support unless amended and also some individuals that are opposed unless amended, that we try to keep those comments succinct and to the point if at all possible. And again, let me reiterate, those of you who are going to be coming up to testify after the 12 minutes and the individuals will be allowed to speak, that I ask that you just state your name and your position and where you're from. I would be very much appreciated. And with that, Senator Leno, welcome, and please proceed.
Thank you, Mr. Chair, for this opportunity to present this bill. We will be succinct. I know you have a very long agenda. We'll be respectful of that. First, let me say that we will accept the recommended clarifying amendment in your analysis on page 15, and then also we will submit a list of additional co-authors as the bill is amended at this time. And again, thank you and your staff for a really very clear and concise analysis. It's a great pleasure to be presenting SB 810, which is our single-payer Medicare for all universal health care reform bill. And I do have to recognize and give tribute to Senator Sheila Kuehl, who so successfully authored this bill in 2006 and 2008 when the bill made its way to the governor's desk. This is a new system that will provide California with what we believe is the best health care in the nation. And I would substantiate that by saying it will lower premiums, thereby attracting employers and creating new jobs. It will also simplify administration, which will be attractive for providers, and then it will also lower costs for families, which will then stimulate the economy. And very briefly, I just want to, because it's such a significant list, thank all of the many co-sponsors of the bill. California Nurses Association, Healthcare for All Californians, California One Care, Physicians for a National Health Plan, California School Employees Association, Single Payer Now, California Teachers Association, California Federation of Teachers, California Alliance of Retired Americans, Amnesty International, League of Women Voters, California Council of Churches, Progressive Democrats of America, Consumer Federation California, National Organization for Women California, Visión y Compromiso, Wellstone Democratic Renewal Club, Dolores Huerta Foundation, California Health Professional Student Alliance, and Courage Campaign. I think we all recognize that minimally we have a very challenged, if not failed, health care system in this country. The World Health Organization ranks the United States 37th among nations in terms of access to health care, quality of health care outcomes, life expectancy rates, infant mortality rates. The OECD, the Organization of Economic Cooperation and Development, has ranked industrialized nations about the top 19 in the world, and it points out that we have fewer doctors per capita in the United States, fewer hospital beds per capita, fewer doctor visits per capita, and shorter hospital stays than each of these other 19 countries. We have the highest infant mortality rate among those industrialized nations. 7 infants died for every 1,000 live births. So the statistics aren't good. And the cost of health care to this nation continues to grow uncontained. As recently as 1960, we spent 5% of our gross domestic product on health care costs. By year 2000, that had grown to 13%. Today, we've already hit 17.6% of every dollar produced in this country is spent on health care costs, with expectations that without significant reform, and we will get to the Affordable Care Act in just a moment, that we could hit 20% of GDP by 2015 and potentially 25% of GDP by 2025. If this weren't tough enough, we're paying twice per capita compared to all the other industrialized and Western nations. And I believe sergeants have already passed out. Do we have this? Okay, just 3 charts to briefly share with you. The first shows the United States compared to other countries in per capita spending, we being at about 7,500, Japan at 2,700. You can see all the European nations that are about 50% or less of ours. The second chart shows the increase in healthcare costs over the past 40 years, and ours exponentially rising at a much greater rate than all of these other European or European Union averages. And then the third chart on the back side of that page is even more telling. The 2 different color bars represent what each of these countries is spending in private expenditures. And you can see in all the other countries other than the United States, the private expenditures is a small fraction of the public expenditures because each of these countries has a form of single payer. And the private expenditures would be that which individuals out of their own pocket are paying on top of the government paying system, not necessarily government provided system. And what's shocking here is that we, though we have the private insurance industry in this country, we're spending as much as a handful of these states in public dollars as they are on their public systems entirely. So the suggestion here is that we could just about, if we spend our dollars more efficiently, cover all of our costs with just the public dollars we are currently spending. The Boston School of Public Health has stated that about 50% of our healthcare dollars is actually squandered, about 30% in administrative waste. We can compare our current system of about 35% administrative costs to about 5% for Medicare, and another 20% in clinical waste as a result of our fragmented system. And this is important to me, and all of us, of course, dealing with the budget as budget chair, that about a third of our state budget, and how this impacts our own finances, about a third of our state budget in one way or another is reflecting health care costs. There's health care costs, of course, in education, in transportation, in every aspect of government, in addition to the cost of our own premiums for our employees. So if you take a third of our state budget, let's peg it at about $85 billion this year, that's about $28 billion. And if half of that is squandered, is wasted, that's about $14 billion annually. If we have a chronic budget imbalance of about 18 to 20 billion, that 14 billion is a significant amount of it. We're going to be very challenged in getting our own state finances in order until we contain our health care costs. Just to remind everybody that a single-payer system, Medicare for all, is not socialized medicine. As Arnold Schwarzenegger had said in his veto message to Sheila Kuehl, it is a public-private partnership, publicly funded, privately provided health care. So your doctor does not change, your clinic, your hospital do not change, public-private partnership. The state of Vermont has now taken the lead among states. Their legislature commissioned a study this past year with the experts at Harvard and MIT. That study came back with 3 different options for them from which to choose, and the one they did choose is the one closest to our SB 810. Their legislature has now passed it. You have your quorum?
Do you mind if I interrupt?
No,
I'm sure you understand the importance of establishing a quorum when
Nothing's
the opportunity possesses itself. Secretary, call the roll, please.
Senator Hernandez?
Here.
Hernandez here. Strickland? Alquist? Here. Alquist here. Anderson? Blakesley?
Here.
Blakesley here. DeLeon? DeSaulnier?
Here.
DeSaulnier here. Rubio? Wolk? Here. Wolk here.
Quorum has been established, Senator. Sorry for the interruption. Please proceed.
Sure. So just to conclude, and we'll get on to our speakers, I was pointing out that Vermont has just passed a single-payer piece of legislation. It should get to their governor's desk. There's the indication the governor will sign it. And the senators, U.S. senators from Vermont, Leahy and Sanders, are now urging, I think they've introduced a bill in the U.S. Senate that would speed up the allowance for federal waivers for states to go beyond the Affordable Care Act from the current 2017 date to 2014. So that is pending in the U.S. Senate. With regard to the Affordable Care Act, it does specifically state that there would be an allowance for what's noted in the federal bill as waivers for state innovation, a new waiver program. The number of that waiver is 1332. We'll have access to it in 2017, if not earlier, if there's a success with the Vermont senators, but should they not, 2017, clearly we have a lot of work to do here in California before 2017 to get all of our ducks in a row so that we would be in a position to apply. And just to give you an idea, if we were to have success in this legislative session, if we were to have a governor's signature, let's say by the end of 2012, we know the industry will challenge it at a referendum on the ballot, so that could happen in 2014. This, of course, is just the policy piece. The fiscal piece of the program would also have to go to the ballot. We cannot do that legislatively due to the two-thirds threshold requirement, which we note we do not have. So there's all of that ballot activity between now and 2017, and all of it uncertain. So this is the time to focus on the hope and the possibility of single payer here in California. And just to quote President Obama with regard to this 1332 waiver, he says, quote, "If your state can create a plan that covers as many people as affordably and comprehensively as the Affordable Care Act does without increasing the federal deficit, you can implement that plan, and we'll work with you to do it." So finally, the savings that would allow for universal health care coverage, recognizing that even the Affordable Care Act will leave about 3 million Californians without coverage, is the administrative savings, which can amount to tens of billions of dollars, the bulk purchasing of pharmaceuticals, durable medical equipment like wheelchairs, eyeglasses, hearing aids, of course, investing in preventive and primary care, keeping people healthier on the front end, saving the expenses on the back end. That's how we can manage this. And I, again, appreciate your allowing us to have this debate and consideration of SB 810.
Thank you. We're going to go ahead and proceed with those that are going to be speaking in support of the measure. As I mentioned earlier, we're going to give a total of 12 minutes for the support and 12 minutes for the opposition.
I think we're going to begin with Deanne McEwen from CNA.
Thank you.
Are we live? Thanks. Good afternoon, Mr. Chair, members. My name is Deanne McEwen. I'm co-president of the California Nurses Association, and I've been a registered nurse for over 36 years. Today, I'm here representing the 86,000 RNs of CNA as trusted patient advocates in support of SB 810. CNA remains committed to reform through the creation of a single-payer health care system. A single-payer system for California, as developed by SB 810, establishes a transparent universal health insurance system that provides every California resident with comprehensive benefits for life. It allows freedom of choice of doctors, hospitals, dentists, eye care providers, and other medical services without limiting patients to a network. It ensures the best use of our money by cutting the current 30% private insurers now spend for overhead to just 5%. SB 810 ensures equal access to a patient-centered, excellent standard of health care for all Californians. You can't lose the insurance if you lose or change your job. You can't be turned down. The bill emphasizes prevention and primary health care and utilizes California's bulk purchasing power to realize savings on prescriptions and durable medical equipment. As an example of the cost savings that could be achieved, Veterans Affairs, a single-payer system, pays about 40% less for drugs than the privatized system through Medicare Part D. This is good fiscal stewardship and sound health policy science. Single-payer is not socialized medicine, it is civilized medicine. It is a publicly financed, privately delivered health care system where everyone pays their fair share, employers, government, and individuals. It's a new and improved Medicare for all. Any taxes we pay under a single-payer system replace the insurance premiums, co-payments, and deductibles that are rising 2 to 3 times faster than wages every year. SB 810 takes current health care spending and uses it more efficiently in order to cover all Californians. The California Legislative Analyst, as well as the Congressional Budget Office, the Government Accounting Office, all confirm that single payer covers everyone without increasing overall health care spending. Our current system continues to leave the insurance companies in the driver's seat, and our patients, employers, and our state end up picking up the tab for this waste. Such waste of precious health care dollars is unconscionable during today's hard economic times. The Affordable Health Care Act has provisions that will help some Californians. The expansion of Medicaid, which extends coverage to young adults to age 26 and places limits on denial for pre-existing conditions for children, yet it leaves in place a health system that panders to Wall Street. Our patients will continue to get denied the care they need. An insurance company bureaucrat will restrict which medical providers and hospitals our patients and families can choose. Your work in crafting a fully mature single-payer bill in California helps to inform the federal work in identifying an approach that makes health care less costly, and it makes certain that it's universal and affordable for all. Single-payer advocates do continue to support SB 810 in California, and this is critical. It was in California that single-payer went from being a socialist plot to a widely accepted and politically feasible alternative to the greed of the private insurance industry. Continuing to work on a more ethical and humane option here establishes the Federal Affordable Care Act as a middle ground solution. Californians deserve better, and we can do better if the political will is there. President Obama is on record as supporting legislation that will empower states to move forward with their own health care plans if they come up with something better. California's nurses know that single payer will ensure every Californian has access to the health care they need, improve our health outcomes, and get health care costs under control for our state and for the business community. We respectfully urge your support. Thank you.
And I just want to remind our presenters that the chair has allowed us 12 minutes for presentations, so we're almost about halfway through that. So everybody can get a say if we can keep our comments to about a minute now. Yeah, that's okay. Hank Abrams from Physicians for a National Health Program is with us.
Thank you. My name is Henry Abrams, and I'm a retired intensive care physician and president of the California chapter of Physicians for a National Health Program. Our 3,000 members believe that Californians want and deserve a health care system that provides every resident with comprehensive and affordable care. As you've heard, the Federal Affordable Care Act makes important strides, but it only gets us part way. Under the Affordable Care Act, as Dr. Leno said, about Senator Leno, half the uninsured population will gain health insurance, but the remainder will not, leaving about 3 million Californians uninsured. But under SB 810, all Californians will be insured. The ACA also leaves many necessary health services uncovered, whereas SB 810 is much more comprehensive. Most compelling is that SB 810 will make health care more affordable for individuals, businesses, and taxpayers, as you have heard, and that's critical for our economic recovery. Single-payer financing is like Medicare. Many call it improved Medicare for all, and I would point out that Medicare is one of our most beloved public programs. Californians understand it, and it makes sense to build upon this approach. Over the past 20 years, 23 different state and national studies have found that single-payer would reduce health care costs by 10% or more in the first decade. Thus, because it has more effective cost controls, SB 810 will greatly improve on the Affordable Care Act's attempts to spend our precious resources wisely. While doctors recognize the many benefits of the Affordable Care Act, we believe that it's only one step toward the system that we need. In a survey in a medical journal 3 years ago, 59% of doctors supported the single-payer approach embodied in SB 810, and I urge your committee to approve it. Thank you.
Good afternoon, Mr. Chairman and members. I'm Dolores Duran-Flores with the California School Employees Association. We are co-sponsors of this bill, and I'll keep my remarks very brief to 3 points. First of all, we support this bill because it's based on a system of everyone paying their fair share and not the full share. And that's particularly important to my members because they've been hit really hard by the health care crisis. Many of them work just for health care. At the end of the month, they sign over their paycheck to the school district. Some go a step further, open up their checkbook, and write it for the difference. Under this bill, it would not happen to them anymore. Also, it covers everyone. That's a very important provision for our members because they want to make sure it's truly a universal system. And finally, it covers everyone from birth throughout the entire course of their lives. My members strongly believe that health care should be a right and not a privilege. So for all these reasons, we ask for your aye vote.
Hello, my name is Chris Willoughby of Willoughby Farms, a farm of 82 employees in the Monterey Bay area, and I'm here to show my support for Senate Bill 810. Currently, Willoughby Farms provides health care for all of its employees, their wives, and their children, but they rarely use it because it is complicated and has a deductible. We have also not been able to increase our employees' wages due to the rapid rise in healthcare costs. In 2010, Willoughby Farms paid 11.4% of total payroll toward employee health care. It is estimated that Senate Bill 810 will lower our health care costs by 12.3% to less than 10% of our total payroll. Senate Bill 810 would remove the need for Willoughby Farms to negotiate health care contracts, saving time, and allow our employees access to more comprehensive and efficient health care, saving money. We support the implementation of the single-payer system in California through Senate Bill 810. Thank you.
I'm Andrew McGuire, Executive Director of California OneCare. I want to underline two key points very briefly. ACA, the healthcare reform at the federal level, doesn't cover everyone. And we will have, as was stated earlier, over 3 million people in California uninsured after ACA is fully implemented. Number two, there are no strong cost controls in ACA. And therefore, the insurance companies may not be able to raise their premiums, but they will be able to raise their deductibles and copays, which is a form of cutting people off from insurance. I want to end with that. Thank you very much, and I urge your support.
My name is Dan Hodges. I represent Healthcare for All California. From my first appearance in 1998 before this committee, when it was chaired by Diane Watson, I've seen how the healthcare system has become so irreparably broken that our arguments for single payer have gone from how it will solve the healthcare system, one critical importance of the SB 810, to how it will also be the best way to address our fiscal crisis of our state, our counties, our city, and our school systems because of the high costs of government obligations for health care and no cost controls. So the fact that SB 810, a single-payer universal health care plan, can both solve the two greatest dilemmas of the state now, the health care crisis and the fiscal crisis, are double arguments why this year, this legislative session, SB 810 should pass, then be financed, and then be implemented. Thank you.
My name is Hugh McIsaac, in Santa Cruz, California, Healthcare for All. As a Director of Family Court Services for LA County and also Director of Family Court Services for Multnomah County in Oregon, and the mayor of a small Oregon town, I know that a great deal of our administrative costs were for health care. And my final comment about this, I'll make it very short and sweet, the cost of the current system is exceeded only by its ineffectiveness, and we need a better system. I think that pretty much concludes our formal presentation. I think there are probably just some people here who would, oh, I'm sorry, well, we have one more? No. Some folks who just want to say they're here to support.
Yes, thank you. Okay, what I'd like to do we have a handheld microphone available? I just would like to ask that everyone just please state your name and your position.
And I would like everyone to be very respectful of the chair's requests.
Thank you very much, Senator. Thank you very much, Dr. Leno.
I'm Kathy O'Neill with Service Employees International Union, Local 10-1, and our 56,000 members are in support of this bill.
I am Jim Dawson, Secretary-Treasurer of the National Board of the Gray Panthers, which has advocated this type of single-payer universal health care for its 40 years of existence, and we strongly support SB 810.
Michael Radigan on behalf of the Board of Supervisors, Santa Clara County, here in support.
Casey Kaneko of Suter and Associates, here on behalf of the Alameda County Board of Supervisors, the City of Berkeley, and AC Transit, in support.
Maxine Mantell on behalf of the City of West Hollywood, in strong support.
Nicole Hudley on behalf of Consumer Federation of California, in support.
Tressa Wallace with Shaw Yoder Antwi on behalf of the City of Santa Monica, in support.
Barry Hermanson, California Green Party. Our more than 111,000 members strongly support this measure.
Roberta Battle, representing the Older Women's League, or OWL of California, strongly in support.
Martha Milhone, a member of OWL, and I strongly support.
Nan Braismer, president of the California Alliance for Retired Americans, and our 900,000 members strongly support.
Randy Hicks of Californians and Disability Rights and strong support.
Rebecca Gonzalez, National Association of Social Workers, California chapter in support.
Libby Sanchez, Laborers Local 777 and 792 in support.
Kevin Insko on behalf of the Friends Committee on Legislation of California in strong support.
Chad Civil, Latino Coalition for Healthy California, in support since 1992.
Chris Jensen from Resources for Independent Living, serving Sacramento and Yolo counties, in strong support.
Lynn Heidekoper, RN, Peninsula Democratic Coalition, in strong support.
Mindy Oburn on behalf of the Nevada County chapter of Healthcare for All. We strongly support this bill.
Tom Swift, Sacramento Gray Panthers, in strong support.
Kathleen Bonnickson with the Nevada County chapter of Healthcare for All and a local attorney, strong support.
Gerald Hunt, board member of Dean Democratic Club of Silicon Valley. We strongly support this bill. Thank you.
James Cowan, San Francisco for Democracy, and Progressive Democrats of America San Francisco chapter, in strong support of the bill.
Santa Clara chapter of Healthcare for All, we strongly support. Lynn Pennicola.
Hi, Santa Clara County Single Payer Healthcare Coalition, but I also am with the Low Income Self Help Center in San Jose. Very worried about the fraying safety net, and particularly that immigrants are less and less covered. Thank you so much for support. If you do support this bill, do support it. Catherine Bach.
Jessica Baker on behalf of the California Commission on the Status of Women, and we support this bill.
Dan Braunstein, president of the Unitarian Legislative Action Network, representing Unitarian congregations throughout the state. We all strongly support this bill.
Robin Brasso with United Educators of San Francisco. We strongly support this bill.
Patricia Crawford, California Federation of Teachers, in strong support of this bill.
Julia Cato, Gray Panthers of Berkeley and the East Bay. We strongly support this bill.
Judith Larson on behalf of Jericho, A Voice for Justice, in very strong support.
Nori Clark, representing the California Unitarian Universalist Legislative Ministry, in strong support.
My name is Rufus Wesley. I'm with the Refrigeration and Retired Union members of Santa Clara and San Benito County. We're 100% behind this bill. Thank you.
Judy Boland with NAMI, California, and also the California Naturopathic Doctors Association, in strong support.
Lisa Patrick Mudd from Single Payer Now Los Angeles, in support.
Mike Romo, also from Los Angeles, member American Federation of Teachers, California Federation of Teachers, strongly in support.
Dolores Sanchez, representing the California Federation of Teachers, very much in support.
Beth Capel for Health Access California, California Pan-Ethnic Health Network, ASME, and UNAC, in support.
Mike Montgomery, Congress of California Seniors. All of our 300,000 members support this bill.
Dave Walrath, representing California Retired Teachers Association, in support.
Donna Norton, representing the Sonoma County Democratic Central Committee and Sonoma County Progressive Democrats, definitely in support of the bill.
Philip Harland from Sonoma County, in support of the bill. And blind.
Sue Eustace, California School Employees Association Insurance Committee Chair, and we strongly support this bill.
Greg Miller from California Nurses Association Retirees, and also the California Alliance for Retired Americans San Jose chapter. Strongly support.
Mindy Stone from Oakland, California, 11 years now, uninsured American. Please strongly support 810.
Elizabeth Landsberg with the Western Center on Law and Poverty and strong support.
Lois Downing, Labor Studies Department, Laney College, strongly support.
Mary Kay Crawford, Pac Christi International, and the Tri-City Democratic Forum in Fremont, strongly support.
Norma Wilcox from the Butte County Healthcare Coalition and Healthcare for All Butte County, we strongly support.
Osmundo Hurtado, San Francisco SEIU, 1021 registered nurses in strong support.
Sarah Flox on behalf of the California Labor Federation in strong support. Thank you.
Kuwaza Imara, SEIU, California State Nurse Alliance. We stand in strong support.
Carmen Fernandez from the Latina Democratic Club of San Joaquin County and CARA, strong support.
Margaret Hobbs, Nevada County Healthcare for All, strongly support.
Carol Garvey, Chair of the Retired Chapter, SEIU Local 521, and CARA Santa Clara County, strongly support this bill.
Ruth Ann Spinner, San Francisco Gray Panthers, strongly support with the adviso of please not to have it go the path of being as watered down as Vermont is turning out to be.
Don Nicodemus, El Dorado County Democratic Central Committee, we strongly support the bill.
Lori Johnson with the California Primary Care Association in strong support.
Billy Taylor, California Senior Legislature from Stanislaus County, strongly support.
Cher Evans, HIV case manager representing my clients, friends, and family in Marin County, strongly support.
Esther Wanning, Healthcare for All Marin, constituents of Senator Leno, strongly support.
Judy Bertelson, primary care physician and geriatrician, strongly support.
Claudia Shope, Santa Clara Democratic Central Committee and Forum, strongly support, and thank you for all your work.
Tricia Hunter, American Nurses Association, California, in support.
Thank you.
Nancy Tilcock, Placer County Central Committee, Democrats, we strongly support.
Carolyn DeGretti, Healthcare for All, Sacramento Valley, in support.
My name is Andrea Garman. I'm a retired machinist, and I strongly support this bill. Thank you. And thank you, Leno, for putting it through.
Diana Madoshi, Villa Senior Networks, Placer County, strongly support.
Anyone else in support of the measure? Thank you. Let me just, before we go on to the opposition, I'd like to take this opportunity to thank each and every one of you out in the audience, also those who came up to testify, who came from all parts of the state, and thank you for participating and being taking an active role in government and in this process. So I commend you for it, and I want to thank you. Was there someone else that wanted to make a statement?
Mary McGill, Solano Contra Costa Cara, and also Southern Solano Democratic Club, who have voted over the 3 times that we voted on this unanimously in support. It's time. If not now, when?
Thank you, ma'am. Okay. Is there anyone in opposition? Please come up. And let me also just reiterate that I will be allowing 12 minutes for the opposition as well. Thank you. Please present.
Thank you, Mr. Chair. Thank you, Mr. Chair and members, and Senator Leno. Nick Luizos on behalf of the California Association of Health Plans. Thank you for the time that you're allotting to our side of the presentation. In respect to the committee's time, I believe we'll be under that time limit. Just wanted to briefly state that, as the committee knows, in March of 2010, the President signed the Patient Protection and Affordable Care Act. This act will result in major changes to the insurance market beginning in 2014. And the goal of that act, of course, is to significantly increase access to health coverage. No matter what you think of the new law, and there are even debates in our industry about what the impact of this law was going to be, the law is the law. This means that California's health plans are currently rushing to comply with provisions that are kicking in this year and in the coming years in advance of the exchange being initiated in 2014. It's a massive task, and we believe that the state can do things to make sure that it's a success, or it can do things to ensure its failure. And in our view, the California legislature has already staked a path. This legislature has passed some pretty significant laws that would implement key elements of that reform, authored by the leadership in the Assembly and former chair of this committee to enact the insurance exchange. And this year, again, we're seeing a number of bills that have been introduced since the enactment of the ACA to implement either a portion of the act or to enact requirements that are expected of the states to complete implementation. We believe that our industry has been a constructive voice in that discussion, and we look forward to continue to offer our perspective. In the meantime, we would ask you to oppose efforts that we believe are counterproductive to that effort and a distraction to the important work that is yet to be accomplished. So for that reason, we would ask you to oppose the bill. Thank you.
Marty Fisher from the California Chamber of Commerce, also in opposition. We are opposed to a government-run system of health care, and we don't believe that this bill is necessary any longer since Congress passed the Affordable Care Act. That act is designed to achieve universal access to health care, and this legislature is busy implementing those provisions, very busy with the implementation. Congress considered and rejected a single-payer system for the country in its enactment of comprehensive reform, and we should follow the nation in implementing those provisions. SB 810 is now irrelevant as a vehicle to provide universal coverage. The legislature has been and continues to be diligently implementing the federal law and should not be derailed by trying to create a new system. Furthermore, CalChamber opposes a government-run system as the wrong approach for California. We fundamentally disagree with the two major premises of the bill, that government systems are more efficient than private business and that a single-payer system would be less costly than the current private system. And California voters have twice rejected a government-run healthcare system, most recently in Proposition 72 in 2004 and then again in 1994.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies, also opposed for the reasons already stated.
Maureen Higgins representing America's Health Insurance Plans, opposed for the reasons stated.
John Lovell with the California Association of Health Underwriters. We're opposed to the bill. I would really incorporate by reference the comments of the first witness because I think they're very important. He talked about the challenges that are going to be facing us to successfully implement PPACA. And he talked about the efforts that this legislature has already embarked upon to address that. And I think it's fair to say that SB 810, however interesting the debate is, and it's a very interesting debate, is a diversion from what need to be the concerted efforts by everyone to make PPACA work in this state. One other point that I just want to share, if this bill moves forward and the debate continues, I would commend to everyone that you take a look at the on-the-ground issues in single-payer countries. Personally, I'm very active in the efforts to free Northern Ireland from British rule. I'm a member of Friends of Sinn Féin. I get all kinds of literature for the Irish freedom movement. And one of the very interesting things that I'd call to your attention is that in Northern Ireland, one of the grievances of the Catholic minority is that their single-payer system, which is fundamentally, as one of their advocates phrased it, political medicine in this country, is that the Catholic minority is not getting the quality of care that the Protestant majority is. And I thought it was a very interesting comment, and I think it highlights that if we're going to go forward, we really need to look at the on-the-ground realities of single payer, so that if this is something that happens down the road, we don't step into those minefields. But for now, we believe that the effort of policymakers needs to be focused on making PPACA a success. Thank you.
Is there anyone else in opposition to the measure? Okay, I believe there was some support unless amended and/or opposition unless amended. Any of those individuals like to come and testify? Okay. Is there any questions from any of the members?
I move the bill.
Okay, we have a motion to move the bill. I have some questions. I have some comments that I'd like to pose to Senator Leno. First of all, we have some very interesting and unique and exciting times ahead of us, in the sense that in 2014 we'll be having in front of us national health care reform in the form of PPACA. Very exciting in the sense that there's more individuals that are going to be allowed or afforded the opportunity to have coverage or access or health insurance. Concerning times, because there's still a lot of uncertainty, with regard to, the ACO models, how it's all going to work. With that, as you know, when I was in the Assembly, I supported AB 8, which was the Nunez bill, but also the single payer, not knowing what was in front of us. We now know what's in front of us, the federal health care bill in 2014. And let me be very clear that I'm a huge advocate of universal health care. I really believe that everyone in this country should have access to high-quality care. The question is, how do we get there? And what's the mechanism? Is it through PPACA, and/or is it the will of the legislature, or eventually the will of the people of the state of California through single payer? So with those opening remarks, and then I'm going to close, because I have quite a few questions, then I'm going to make a few more statements. But Senator Leno, you did make some comment with regard to the implementation, the timetable, but I want to kind of see if you can kind of fill in some of the blanks with regard to the timetable for implementing the bill. Kind of go through that very quickly with regard to the when you think it should go on the ballot, just a little bit more in detail, if you don't mind.
Sure. I can only give you best case scenarios, so let's say this is my dream come true, and more than a state full of dreams come true. Should we succeed in having the governor sign this into law, recognizing this is our plan to have this a 2-year bill, so that would be as soon as summer of 2012, that we believe that there will be signatures gathered subsequent to that to attempt to overturn it on the next state ballot. So that's 2014. So that would put the bill in limbo. And that's going to be a reality. As I mentioned, we also have the financing piece, which is not included in 810. So there may be some legal questions here, whether, for example, once the governor signs it, ostensibly in 2012, could the Premium Commission begin to do its work? And the job of the Premium Commission in this bill would be first to identify what exactly the state of California is currently spending on health care costs. It would be in the neighborhood of $200 billion plus. Their next step would be then to determine, with the success of a federal waiver, accounting for all the federal dollars that would go into our health care trust fund, along with all the state dollars we already spend on health care into our health care trust fund, along with the savings, as I've already mentioned, from bulk purchasing, from leaner administrative costs, preventive and primary care savings, put all that into the health care trust fund. Then to figure out the last piece, which is what would be the employer and the employee contribution. The Lewin report of 2006 pegged that at, I believe it was 16% then. There have been some increases in health care costs since then, but also the Affordable Care Act will bring $124 billion federal dollars to California over 10 years. That also could go into our health care trust fund, which would then lower the employer-employee contribution. So that has to be determined by the Premium Commission. Once they have set that, that finance plan then has to go to the voters to be approved, because it would be necessary for that. So we're in the neighborhood of 2014 or 2016 to either fight back a referendum or to proactively, through initiative, put forward our finance plan. So you can see there are many, many steps. It will take us very close to 2017 when we would then be able to apply. We could not apply for the federal waivers until all those accomplishments had been done.
Okay. So you're anticipating that's when the federal waiver, we would be submitting the application then?
Correct.
Okay. All right. Let me just kind of...
And then, sorry, just a last step here. Many steps here. But and actually, before then, even after the vote of the people and the success of the ballot measures, the Secretary of the California Department of Health and Human Services would have to certify that there is a sufficient funding mechanism before this can be implemented, and not only for the implementation of it, but also for the actuarially determined reserve fund, as in any private health insurer required by the state to have a reserve fund. So the Secretary of Health and Human Services would have to make that determination, so it inherently cannot be underfunded. And then we would apply for the waivers.
Okay, let me just kind of express some concerns I have. As was mentioned in the opposition with regard to PPACA, obviously we're in the midst of setting up the exchange, and thanks to Senator Alquist for her what she did last year with we're one of the first states to set up that exchange, and we're beginning to implement other reforms such as Medi-Cal coverage expansion and a systems to review health insurance rates. Unless Congress moves up the date for states to apply for the waiver, which seems unlikely, the earliest we could receive the waiver, as you mentioned, was 2017. So that's my concern. But I'm also concerned that we haven't given healthcare reform, enough of a chance to see if it works, to find out if we're going to save. So stating that, don't you think that still this may be a little immature at this point, this bill?
Actually not. I think they're very compatible, as I imagine Senator Alquist does as well, since she's made the motion for the bill. The exchange creates an independent public entity, as you know, that does many of the same kind of things that a single-payer system would do. And so, for example, it creates a health trust fund, which our bill does as well. So a lot of what the Affordable Care Act puts in place would be an infrastructural component of single-payer when we get as far as we hope to be by 2017. So there's nothing really that we'll be doing legislatively or through advocacy work that will interfere with the state's implementation of the Affordable Care Act. And additionally, there is a payments board which allows for the bargaining between the state and the private insurers. That's, again, similar to what we would have in single payer, though, of course, we would be negotiating directly with the providers as opposed to the middleman of the private insurers. So it's very much similar mechanisms, but nothing that actually interferes with the implementation of Affordable Care Act. And again, one of the concerns, and I give full credit, full sincere credit to the success of President Obama and the leadership of Speaker Pelosi in the accomplishment. And we saw the kind of interference that was run in Washington in their attempts to get as much as they did out of Washington. But it will still leave approximately 3 million Californians, when fully implemented, yet uninsured. So no one claimed it was universal coverage. Single payer will be.
Right. Okay. Let me just a couple more concerns. Obviously, even if you disagree with the LAO numbers, I'm concerned that this would expose the state to a huge physical risk over time, and a time when we're struggling for adequate funding and for existing programs. How do you address that with the fact that the LAO is going to predict that there's going to be an increased cost to state government?
It's a very astute question, Mr. Chair, and it's the same one I asked Sheila Kuehl in 2008 when she brought it to our Assembly Appropriations Committee, which I chaired. And what Senator Kuehl answered, and accurately so, was that the LAO identified that the cost of this would be approximately $200+ billion. That is exactly what we're spending currently on healthcare in California. So it's no new money. It's exactly the same amount we're currently spending, but in a much more efficient way, in ways I won't repeat that I've already described. The differential between the 16% payroll contribution was based on the Lewin Report's 2006 cost figures. By the time it would be implemented, once her bill was reintroduced in 2008 to take effect in 10-11, healthcare costs had grown so significantly that the 2006 figures no longer worked. So that was the differential, using 2006 based figures for the new costs of 10-11. So that's an acknowledgement. The point is, the longer we wait and the higher healthcare costs get, the greater that differential is going to get. The sooner we do this, the sooner we begin to contain costs.
Okay. Let me just, couple last comments and maybe one last question before our last comment. According to the recent analysis by the Kaiser Foundation, in virtually all counties and all countries, including Canada and other countries with single-payer system, healthcare costs are increasing faster than the rate of economic growth. And I know you gave us this chart earlier that states, how where the United States is compared to the rest of the country. But then I was also given another chart that shows that everything else is total expenditures in healthcare as a share of GDP is increasing in leaps and bounds. So how do you know that this bill will do any better in controlling costs compared to the other systems in Canada and other countries as well? Because does this particular bill have any kind of specific cost containments to help us make sure that we control cost?
The Kaiser Foundation study, which I'm familiar with, said a number of things. You are correct. It identified that European nations, single-payer nations, as well as the United States, has seen increases in healthcare costs, though the cost increase rate in the United States is significantly greater and faster than in those other countries. The Kaiser Foundation report also stated that 40% of the employers surveyed said they were likely to increase the amount of their workers' pay out of pocket for doctor visits. It also said that almost as many employers were likely to raise annual deductibles and the amount workers pay for prescription drugs. 9% of employers said they plan to tighten eligibility for health benefits, and 8% said they plan to drop coverage entirely. So that report shows that the status quo is only going to put a greater burden on working people in the years ahead and employers.
Okay, let me just close with this comment before we move on to the vote. As I stated earlier, I'm a huge proponent of universal health care. I believe everyone should have access to quality care. Obviously, we need to look at pre-existing conditions. We need to look at access. But over the years, serving in the legislature and looking at our healthcare system and comparing it to other countries, it's an extremely complicated system. And here's what I've come to realize, that we have a two-tiered healthcare system in this state and in this country. I really believe we have and I'm hoping that we get to that point where either a bill like this or PPAC addresses that. But we have a healthcare system, one for the poor and one for the wealthy. And you had stressed and made some comments earlier in your opening remarks. When we look at the poor communities, which are predominantly the communities of color and or the rural communities, which have the highest incidences of chronic diseases and or problems, but yet it is those communities that have the fewest number of healthcare providers to go to those communities. I know that this is not the bill that's going to solve all those problems, but if we're really going to solve healthcare, we need to look at making sure that we get providers that go to these specific communities. And then if you look on the flip side, you have the more affluent communities. You have communities that have less chronic disease, but yet per capita more providers that go there. We have a much bigger problem in the sense that we have very few primary care providers that are graduating from medical school. More and more of them are going into specialty care. And the bigger problem I see we have, and I'm hoping that I can't see and I don't know how this is going to address it, I'm just kind of speaking my frustrations of the lack of access is the poor Medi-Cal reimbursement we have. But not only that, and even if this addresses the very poor, inadequate Medi-Cal network that we have. So to me, I mean, if we're going to start looking at healthcare, we need to look at addressing access problems to the communities that need it the most. But more important, we need to look at the workforce issues and the important part of it, the diversity of that workforce issue. So that's just kind of my statement of how we need to approach and look at healthcare. So with that, we do have a motion from Senator Ahlquist. You know, I have had some concerns. I have some reservations. But in light of the fact that I really believe we need to still continue to have this discussion, I'm going to, at this time, support the measure and ask for an aye vote.
Thank you, Mr. Chair. If I could just briefly?
Yes.
Thank you. And I know when I've got the votes, I should thank you very much and turn away. Just very briefly, you bring up so many good points. And I'd love to invite you to be on our technical advisory group, which is professionals and scholars and those who know about this, about our current healthcare system, to work out many of the points that you're addressing. And with regard to the status quo, as you just described it, as long as we have a healthcare system such as we do, which divides us into those who are profitable and those who are not profitable, those who are not profitable will always suffer in provision and quality of care.
Yeah, well, I'm not disagreeing with you, but my argument, if we're looking at a much bigger policy discussion with regard to access to health care, doctors don't go to poor communities, and even by giving them more money, it's not going to get them there. So if we really are going to be addressing the issue of inner city, rural communities, we need to address the workforce to get them to go to those communities and look at other mechanisms. So this is just a part of the puzzle. And I've said this over and over again. You can wake up tomorrow and every single person in this state has a health insurance card with low deductibility. It's not going to put doctors
That's the truth.
in a poor Latino community or in the rural communities or where the farm workers are at. So if we want to really address health care, we need to do it through our workforce, Senator Leno. But anyway, I'm prepared to vote for this bill. Secretary, call the roll.
Senator Hernandez?
Aye.
Hernandez, aye. Strickland? Alquist? Aye. Alquist, aye. Anderson? Blakesley? De Leon? DeSaulnier? DeSaulnier, aye. Rubio? Wolk? Wolk, aye.
That vote is for. We're short one. We'll put the vote on call and lift it when all the rest of the members are in, Senator Leno.
Thank you for your support. Thank you for your time and for your welcoming so many people in support of this.
Thank you. And again, let me thank everyone who did show up today to present. I'm assuming most of you will not be staying, and I wanted to thank you. All right. Now, we do have a quorum established. I'd like to direct your attention to file item number 14 and 15, which is SB 945 and SB 946, which are a consent calendar. However, I'm going to temporarily remove SB 946 from the consent calendar for purposes of a minor amendments, which is described in the analysis. So without objection, the amendments will be accepted and the bill will be placed back on consent. We do not have to take any action or vote on that, but I just needed to state that. So with that, we'll be putting that back on consent. And we have a motion to move the consent calendar by Senator Wolk. Secretary, please call the roll for consent item SB 945 and SB 946.
Senator Hernandez?
Aye.
Hernandez, aye. Strickland? Alquist? Aye. Alquist, aye. Anderson? Blakesley? De Leon? DeSaulnier? DeSaulnier, aye. Rubio? Wolk? Aye. Wolk, aye.
That is for. We're still short one vote, and we'll put that on call. I believe we have Senator Gaines. Okay, Senator Gaines, we have item number 10, SB 751, Healthcare Coverage Provider Contracts. Good afternoon, and please present.
Great. Thank you, Chair Hernandez. I've got an opportunity today to present Senate Bill 751, Healthcare Transparency. And I'd first like to thank the Chair and his staff for the hard work on this measure. Senate Bill 751 is a very straightforward measure. It simply says that contracts between health plans and hospitals cannot have gag clauses that restrict the ability for health care members to see cost and quality data. This will ensure consumers are informed of the actual costs they are paying for their health care. Today with the committee, I've worked out some amendments to address concerns from the Chair and the hospitals. The First Amendment requires that any quality-related information shared with consumers be risk-adjusted. Second, we have an amendment that addresses a request by the hospitals to review the data provided to consumers. Third, we are accepting an amendment to carve out capitated contracts between hospitals and plans. And current law already ensures consumers receive price information after the service has been rendered through an explanation of benefits. EOB Senate Bill 751 will ensure consumers have access to this information before they receive their care. Existing law also does not prohibit or prevent health carriers from furnishing information on the costs of procedures. However, increasingly, contractual agreements between health carriers and providers can prevent this information from being released, particularly when a large provider has market power. As the committee is keenly aware, healthcare costs continue to grow at a rate faster than both general inflation and wages. This makes obtaining health insurance increasingly difficult for individuals to afford and for employers to offer in the workplace. By giving consumers cost and quality data, we are empowering them to make informed decisions about their health care, which I believe is one part of the equation to stem the tide of escalating cost. With that, I'd like to ask for your aye vote.
Thank you. I appreciate the amendments that you're going to be taking. I did note that you forgot to mention to make other technical amendments noted in analysis, comment number 6 and 7. I'm assuming those are also the ones you'll be taking as well?
Yeah,
I just wanted to make sure and clarify that. Okay. Those in support, please state your name and position. Thank you.
Mr. Chair, members, Mark Whiting on behalf of the Blue Shield of California, not-for-profit health plan in California that represents 3 million Californians. And hundreds of thousands of which are CalPERS members in the state. In 2007, Blue Shield joined with labor and other large payers to support a bill that gave CalPERS the right to see hospital cost data. That bill is AB 1296. This bill is a next logical step. It would allow not just CalPERS to see this data, it allows people to see this data. So CalPERS members, consumers across the state of California, to see what it's going to cost when they walk into a hospital and get a procedure, and to get that information before they walk into that hospital. This is very important. If you think about today's healthcare marketplace, consumers are paying a lot more out of pocket. They have higher co-payments, they have higher deductibles, they have higher cost sharing. They deserve to know before they walk into a facility how much this is going to cost them. If you take a situation where you have a procedure, I'll give you one example, a spinal fusion, for example, the price for that can vary in Blue Shield's network from $2,000 to $36,000. If you're paying 10% of the cost of that, the difference between $200 and $3,600 to that consumer is a big deal. For them to have that information and be able to determine before they pick a facility what their cost sharing is going to be and that they can get just as good a facility at a much lower rate is important information that consumers should be armed with. You know, today if you think about the information we have about the TVs we buy, the washers and dryers we buy, the electronics we buy, we have a lot of information about how much they cost and how good they are. We don't have that same kind of information about the hospitals we go to, about the facilities that we trust with the health care of ourselves and our families. It's time that we have that information and consumers have it. For that reason, we support this bill.
Thank you.
Mr. Chairman and members, I'm Dolores Strand Flores with the California School Employees Association. We're here in support of this bill as well because we believe it's great policy to have information on, transparency of cost and quality information. Many of our members are having to shoulder increasingly more costs in terms of premiums, co-payments, deductibles, and they're also looking at the individual mandate that most people are going to have to provide, make sure that they have health care for them and themselves and their families. We think it's critically important for them to have access to this information so that they can make informed decisions about the health care quality as well as the cost that they're going to have to shoulder. We also strongly oppose gag orders that prevent our members from having access to this information. We think this is a really good consumer bill, and we ask for your aye vote.
Mr. Chairman, Senators, Terry Brennan on behalf of SEIU California. I just wanted to expand very quickly on what Mr. Weideman had to say. In 2007, we did this transparency project at CalPERS. Since then, they've broadened their value-based purchasing program and capitated some of the reimbursement rates to hospitals, specifically in knee and hip replacement, where the costs vary from $15,000 to $115,000. The difference between the $30,000 that they're reimbursing to the 46 hospitals who have agreed to accept that rate and what other hospitals charge is a complete unknown entity. You could be walking into a hospital knowing full well that you're going to be on the hook for some number above $30,000, but no idea what that amount is absent this information. This is critical for us moving forward on a value-based purchasing program and dealing with one of the leading cost drivers of health care. That's why we support the bill. Thank you.
Thank you. Next.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. We're currently reviewing the amendments but are in support of the bill in concept.
Thank you.
Maureen Higgins representing America's Health Insurance Plans in support of the bill.
Thank you.
Kevin Pedrati representing Aetna, strong support of transparency. Thank you.
Thank you. Anyone else in support?
Misty Johnson, California Retailers Association. As large employers, we are in support.
Charles Baca with the California Association of Health Plans in support. Thank you.
Thank you. Anyone in opposition to the measure?
Good afternoon, Mr. Chairman and members. Martin Gallegos with the California Hospital Association. We are here opposed to this measure for a number of reasons. First off, we don't think the bill is necessary. Currently, if health plans don't want to contract with a gag clause, they simply don't contract with that hospital. I mean, this is how it's been handled all of these years and under current law. If two parties don't agree to the language in a contract, they just don't contract with each other. That being said, this particular bill, while it makes an effort to provide additional information, we don't think it goes far enough. Hospitals are not opposed to transparency. We engage in those efforts all the time, currently under contracts that we have with health plans and under payers. In this particular case, though, we think that the bill is still inadequate if we're going to provide meaningful, understandable, valuable information to consumers. And let me explain why I think that's the case. The language on risk adjustment only provides risk adjustment for half of the data. It risk adjusts quality, but it doesn't risk adjust cost. So you're not giving consumers an apples to apples comparison when they look at cost and quality. And that's very important. Not just how much they pay, but what are they getting for the price that they do pay. So we think that's a major flaw. The elimination of the capitation in the bill, there are hospitals that do a large amount of capitation as part of their contracts. Capitation has been proven to be an efficient way and an inexpensive way of controlling costs on health care expenses. If you don't show and report the capitation rate, all you're going to show is the more expensive rates that are paid to the hospital outside of the cap rate. And of course, the hospital is going to look more expensive. So it's not fair for a hospital that provides a great deal of cost-effective, inexpensive care through capitation that they're going to be skewed in their report of this data as being an expensive hospital. The review of the data, while Senator Gaines did say it provides an opportunity for hospitals to review and comment on the accuracy of the data, there's no requirement here and there's no holding the feet to the fire of the health plans to do the correction if errors are found and pointed out by the providers to the plans as they review the data. And lastly, if we're talking about meaningful and useful information on the true costs of a procedure for a consumer, we should be reporting that data in a bundled episode of care format, because to separate hospital rates out of all of the other costs that are part of a surgical or any kind of medical procedure, such as physician rate, pharmacy, lab, etc., doesn't give the consumer a clear picture of what the total cost is going to be for that procedure. This bill would only say this is your hospital cost for that procedure. In most cases, plans do report this data as a bundled episode of care. But there's no provision to require in this bill that those plans do that. And I think if you don't, then you could potentially mislead consumers if you're only going to show them one piece of the cost of a total medical procedure. So for all of these reasons, Mr. Chairman and members, we respectfully request a no vote.
Thank you. Next.
Good afternoon, Mr. Chairman and committee members. My name is Angela Gilliard. I'm the Legislative Director for the University of California, and I represent the 5 academic medical centers and the 16 professional schools. We are here today with a position opposed unless amended. And on the outset, I need to say that the University of California supports transparency. We just believe that the companion to transparency is accuracy. We heard in the testimony of the supporters that they don't understand why a hip replacement could cost anywhere from $30,000 to $100,000. There's a reason for that. If it's a first hip replacement, we need to know, and the consumer needs to know it's a first hip replacement. If it's a third hip replacement or a second revision, a much more complicated procedure, consumers need to know that. So in the example of a TV, you need to know if you're buying a low-end Sony or if you're buying a Magnolia, Hi-Fi, whatever, the big, electronic devices. There's a difference. And there's a difference in, and with regard to healthcare, I mean, we're not buying TVs. I mean, it is about your health. You need to understand how complicated the procedure is, what if the consumer has any comorbidities present or different kinds of acuities from other consumers. One consumer's health condition is different than another consumer's health condition. If you want to give consumers accurate information, they need to understand that they need to understand the rate that they're being quoted. So one of our primary concerns with this bill is it doesn't risk adjust for the cost. We do recognize that the amendments risk adjust for quality. We think it just needs to do the same thing with regard to cost. I think there are probably a couple of other issues. Those are probably our main issues that the university has. The university, with its 5 academic medical centers, including the 10 hospitals, is the 4th largest healthcare delivery system in the state of California. And we do see some of the most complicated cases in the state. And so sometimes our costs, and maybe often our costs might be quite more significant. That's why we are very concerned about having the apples-to-apples comparison, and then we think that's fair.
Okay, thank you. Anyone else in opposition? Is there any questions from any of the members?
More of a statement. Senator Gaines, I think I'm very thankful that you're bringing this measure forward, and the fact that, I think people have a right to know. I mean, I understand some of the arguments, and you might say, well, this is your second hip replacement, but, I'm sure you can do cost comparisons among people who are having their second or third hip replacement. I always fall on the side that people need to know all the information out in front, including cost, including care. And that's why I'll be supporting the bill today, is because, again, it comes right down to if this was your wife, your grandmother, your family, you're going to want to do cost comparison, not just on the cost, but also on the care as well. So I commend you for bringing this measure forward.
Thank you.
Okay. Senator Wolk, you have a question.
Briefly, Senator Gaines, I'm listening to those who have raised concerns. I assume you'll be working in good faith with the opposition to see if you can meet some of these concerns.
Absolutely.
All right,
Yeah.
I appreciate that. I'll vote for this today, but then
Great.
want
Thank
to
you.
see some of that taken care of. Thanks.
Okay. Yes, Senator Anderson.
Senator Gaines, we had spoken earlier about, I don't have my glasses, I'm going to throw them on the phone. Capitalization rates.
That is not included.
Thank you.
Yeah.
Okay, I'm going to just make a couple comments and not ask any questions at this time, and then we'll be asking for a motion in just a second. As I mentioned earlier in the previous bill, we have some very exciting times ahead of us with regard to the implementation of the federal health care bill. But in light of that, I really believe a big part of being successful in healthcare or the implementation of it is transparency. So I want to commend you for bringing this bill forward. I know you've carried it in the past, and I'm going to be supporting the bill and asking the members to vote in the affirmative as well. I understand and know that the opposition does have some concerns with regard to quality versus the cost, also the elimination of the capitation rates, and the bundling episodes. I'll be honest with you, I've toiled with it quite a bit, and I know we were trying to come to a fine balance, which is what would be the best public policy. What I would like to ask of you is to come on as a joint author, because I believe in this particular policy. So as we move forward, I still will always be open, but at this point, I'm going to be supporting the bill in its current format. But I really believe that at least I think we've hit a nice balance of how we need to make sure that there's some transparency with regard to health care. So is there a motion? We have a motion. Senator Strickland, Secretary, call the roll. This is due pass as amended. To the floor.
Senator Hernandez?
Aye.
Hernandez, aye. Strickland?
Aye.
Strickland, aye. Alquist? Anderson?
Aye.
Anderson, aye. Blakesley? De Leon? De Leon, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Rubio? Wolk? Wolk, aye.
That bill has 6. We're going to put that on call to allow any of the absent members to add on, and that has sufficient votes to get out of the committee. Senator.
Chairman Hernandez, it's an honor to have you as a principal co-author. I appreciate that.
Thank you.
Wonderful. Thank you.
Joint author. Okay, we have item number 8, SB 617, Calderon Healthcare 615? 615, sorry. Calderon Healthcare Service Plans, Accident and Health Agents Licensure. Senator Calderon, welcome.
Thank you, Dr. Hernandez and members. I'm very happy today to present to you SB 615. When someone considers buying health care, whether it's insurance, whether it's Knox-Keene, it's a very serious matter, it's a very complicated matter, and there's some serious consequences if you if you purchase the wrong plan for you or your family. For this reason, consumers need confidence in those that are helping them, advising them, consulting them on these health care plans. SB 615's goal is to strengthen the healthcare marketplace by strengthening the credentials of everyone that sells healthcare services or healthcare plans. Now, I've worked with your staff and am willing to accept the amendments, setting mandatory training requirements, including ethics training for solicitors and solicitor firms by January 1st, 2013. The second amendment is requiring insurance agents to meet a similar ethics standard under DOI supervision and to get trained, and to be trained on the Affordable Care Act, the public health programs, and the California Health Benefits Exchange. And then the amendments also that I am taking also clarify that the Healthy Families Program, the Access for Infants and Mothers Program, and the Medi-Cal program is not impacted by this bill. We have benefited from very productive discussions through the hearing process and to this point, and I look forward to continuing working with all the stakeholders and coming to a comprehensive bill, and I ask for your support and your aye.
Thank you, Senator Calderon, and we appreciate the fact that you're taking the amendments that were recommended. And anyone like to speak in support of the measure, please state your name.
Yes, Dr. Hernandez, members of the committee, my name is John Lovell, and I'm with the California Association of Health Underwriters. We represent the independent health insurance agents in California. Globally, health insurance agents are responsible for getting more people access to health care than any other cohort. That said, we recognize that, as Senator Calderon has indicated, the purchase of health insurance, health coverage, is a life-impacting decision. It isn't like buying a television where, oops, you got a 58-inch LCD rather than a plasma. I mean, this is life-impacting, and as a consequence, the people who deliver that to consumers ought to be trained. They ought to have high ethical standards, and they ought to be accountable for what's delivered. 49 other states in the country provide that one must be licensed to sell either health care service plans or health insurance. California does not require licensing for health care service plans. Now, up to this point, those issues have been dealt with between the health care service provider and the agents. They've done it contractually. But members of this committee, we're entering into a new world with PPACA. And it's important that with this whole new cohort of people who will be buying insurance, that they have confidence that the products they are being given are the best for them, and that there is a way to hold the person who facilitated that purchase accountable if something goes wrong. We support this bill. This is a big bill. It's a work in progress. There will be continued discussion. The discussion so far on this bill among all of the stakeholders has been extremely constructive, and we really want to thank the author for his leadership in moving this forward. Thank you.
Thank you. Next.
Good afternoon. Sherry McHugh, representing the National Association of Insurance and Financial Advisors. We strongly support the bill. We support licensure and proper training for all individuals selling HMO and PPO products. We look forward to continuing to work with the author and other interested parties to further refine the bill and to make sure that consumers receive the protections that we believe they deserve. Thank you.
Thank you. Next.
Good afternoon, Mr. Chair and members. Erin Norwood on behalf of the Insurance Brokers and Agents of the West, and I would just echo the comments made by the previous witnesses in support of the bill. Thank you.
Thanks.
Beth Capel on behalf of Health Access California. We have been opposed to the prior versions of this bill, and very strongly so. We very much appreciate the amendments that were taken today and appreciate the work of the author and his staff, and also of the committee and the committee staff on this issue. We would ask that if the bill is further amended, that it be brought back to the committee for review, because the amendments have been crafted here, and we would really appreciate that. In looking at this issue, a couple of points. California is the only state in the nation where we have 2 regulators, so it is not a surprise that in 49 other states, it's the Department of Insurance that licenses those who sell insurance. California is the only state where we have a second department, the Department of Managed Healthcare, which regulates 80% of the health insurance sold in California. That separate structure of regulation includes a lot of things that are not included in the Department of Insurance, including the review of all marketing material. This bill does not at this time require that. It's something we'd support and have suggested as an amendment previously. What the bill does include, and we think is appropriate, is that solicitors who sell health care service plans be trained to a level comparable with what insurance agents are trained with respect to the 20 hours of training about health care coverage and 12 hours of ethics training. We think that very modest level of training is an appropriate level. And with that, we're pleased to remove our opposition and to be in support of the language as it is before this committee today. Thank you.
Thank you. Anyone else in support of the measure?
Mr. Chair and members, Vanessa Kahina with the Western Center on Law and Poverty. We had also previously had an opposed unless amended position with the amendments in front of you today, particularly those surrounding the navigators and the exchange language. We are able to remove our opposition and greatly thank the author and his staff and the staff of the committee.
Next, sorry.
Susie Shoup with the California Children's Health Initiatives, United Ways of California, PICO California, and also speaking on behalf of the 100% campaign, which is a collaborative of the Children's Defense Fund, Children Now, and the Children's Partnership. We also would like to remove our opposition to the bill and become neutral at this point. We really do appreciate the stakeholder process and very much enjoyed working with all the stakeholders on this, and also would very much like to thank you, Senator Calderon, for your work on this. I guess that's it. Thank you. Nothing else to say.
Somebody's got to oppose them.
They closed me in the last series.
Okay. Anyone else like to speak in either support or opposition?
Good afternoon, Brianna Learman-Hinsey on behalf of the Local Health Plans of California. We too had previously opposed this bill, but with the amendments being accepted by the author, we would like to remove our opposition and thank the author for working with us and all the other constituents.
Thank you.
If I might, Mr. Chair, my apologies. Beth Capel, also representing AFSCME, which represents the workers at Kaiser Permanente, and with these amendments that no longer require Kaiser employees to be licensed agents, we remove our opposition.
Thank you. Before we proceed with any comments, when you were reading the amendments that you were willing to take, I wasn't sure or wanted to clarify that you were still going to remove the requirements that the CDI regulate agent brokers be used to sell DMHAC licensed health plans.
Let me confer with Mike. Can you repeat that again, please?
That remove the requirements that CDI regulated agent broker be used to sell DMHAC licensed health plans. That was one.
Absolutely.
Yes, and then the other ones was that providers exemptions for navigators.
Yes.
Okay, perfect. Because I didn't hear that. We didn't hear all of that when you in your opening statement. I just want to clarify that before we move forward.
Sorry, I didn't mention it, but yes, it's
no
in the bill
problem. Okay, is there any comments or questions from any of the members? Yes, Senator Alquist.
Just to say that I thank the chair, his consultants, and the author for crafting these amendments. Makes it a really good bill. I'm supportive, and would be happy to move the bill.
Okay, we have a motion by
Ron Calderon and Beth Capel working together.
Put this in the book.
Okay, we have a motion by Senator Calderon, and the motion is do pass as amended to appropriations. Please call the roll. Oh, I'm sorry. I didn't see you.
Senator, I had some concerns with the bill in the sense that I think there's a lot of focus on the sale of the policies, but not the service. And what I'm concerned about as you move forward with this, and what I'm going to be watching closely, is that consumers are protected. And what I'm worried about is people who have the best intentions without the proper training selling products that are complicated and that should be tailored to the individual groups and organizations and individuals that want to purchase those products. And I think that at the end of the day, I hope that as you move forward and look at additional items and amendments, that we put the consumers first, because I fear that we may be going in the wrong direction if we continue down this path. But I'm prepared to support it today. I know how hard you're working on it. Thank you.
Thank you, and I appreciate that comment. And I'd like to say, in support of this bill, this does make the training mandatory for the very first time ever. So we're on the same boat.
Okay. Would you like to close? Any other comments?
No, I appreciate your support. I appreciate the committee staff and all the hard work that you invested with our staff in making sure that we addressed everyone's concern to make this a better bill. And I look forward to moving the bill forward.
Thank you. Again, do pass as amended to appropriations. Call the roll.
Senator Hernandez.
Aye.
Hernandez, aye. Strickland. Alquist.
Aye.
Alquist, aye. Anderson.
Aye.
Anderson, aye. Blakesley. De Leon. DeSaulnier.
Aye.
DeSaulnier, aye. Rubio. Wolk.
Aye.
Wolk, aye.
That bill has 5. We'll go ahead and put that back on call to allow the absent members to add on, but it has enough votes to get out of the committee, Senator.
Thank you very much, Mr. Chairman. Members.